Hello, massage nerds. One of my followers asked me, how do you do a medical history when you're going to do a medical massage or a neuromuscular massage, which is a little bit different than when you're just going to do a Swedish massage. The number one thing you need to allow for is a little bit longer time, because obviously you can ask a lot more questions. I want you to think as you're investigating something, you're investigating a case. This is the part that I really enjoy from neuromuscular and medical massage treatments, because they're very specific and you're trying to get as much information as you can from your clients. So be aware that you're going to need a little bit more time with your client to do the interview, to ask the questions. So I usually allow, 15 minutes, because when you're going to do a Swedish massage, they fill out the form and they usually don't have any issues, right? So with a medical history for more specific work, you want to make sure, of course, list of medications. And you also want to ask if they've seen a doctor, or if there's a diagnosis from a medical professional that has diagnosed them, as to what's wrong with them. Because most clients come in and they say, oh, I have a rotator cuff injury, but they don't tell you specifically which muscle. There are 4 muscles to the rotator cuff. Is it the supraspinatus, the infraspinatus, the teres minor, the subscapularis? So they're not going to know that. So it's our job to ask as many questions like, how did the injury happen? What were you doing? Do you remember exactly what you were doing when you were, hurting, or how long after you did? Let's say you were playing football or softball or volleyball or whatever the case may be. You must investigate. You must ask them. A lot of clients don't even know how they injure themselves. I've had clients that have told me they hurt themselves in the sleep, and one of them is because she slept with her arm straight up underneath, and eventually it started, really wearing down her, she slept wrong and hurt her shoulder. So it's our job to investigate and to ask questions like, how did you injure yourself? I have another client that reached to the back seat, to get her laptop from the back seat, and when she pulled it, she tore her subscapularis tendon, which is on the anterior part. And this is where the information is very handy, because that's exactly what that told me. It's like when she reached back and she pulled it, and she says that it hurt right here, then I knew it was the subscapularis and I needed to work, that muscle. So the more information you have, and the more you know your muscles and how they work and what the action is, the better you're going to get at getting to exactly what muscle is injured and what synergist muscles you need to work on. And okay, so investigation is very important. Finding out what the doctor has said and if they have a diagnosis, very important. Another thing that's very important is, doing some of the tests, some of the passive tests, like let's say somebody has, shoulder problems, you might want to do the Hawkins-Kennedy test, or the slump test for somebody that might have, nerve problems in the low back, or the straight leg test, or the Bragger's test for sciatic nerve, and the performance test. So learn about the test, and you can Google them. You can Google, a test for the sciatic nerve and learn how to do them. Just beware that you want to be gentle with these tests. You never want to take a client past the range of motion or be aggressive or force anything. When you do a passive test, you don't want to force anything. You got to go just to how far they can move. This is just to give you information of what you need to do. So these tests can be important and tell you. And I've had clients a lot of times that come in and tell me, oh, this is as far as I can lift my, my shoulder with frozen shoulder. And, it hurts when I start lifting, and I feel the pain right here. And right away that tells you probably supraspinatus, probably being pinched between the acromion process of the scapula, and it hurts because the supraspinatus is the one that does the raising your arm to begin with, along with the deltoid. So anyway, you've got to know your muscles and write down all the information. And I want to show you this form that I have, and I will include a link below, or contact me at Massage Therapeutics 915 at gmail.com, and I can email it to you if you'd like. But as I'm interviewing the client, I'm also, highlighting what muscles could be. And these are broken down into lower extremities, upper extremities, rotator cuff, back, neck, head. So I highlight, and then this tells me what other synergist muscles I need to take a look at. This is a very important form that I use, and it really helps me to, to be able to see what all I need to work on. When you're working specific injuries, you do not want to spend an hour working on just the shoulder or working just the low back. That really overstimulates the nervous system, and you don't want to do that. Even when you go to a chiropractor, they usually, that does 15-minute increments of massage. That's all they do. 15 minutes on your shoulder, 15 minutes on your back, 15 minutes on whatever it is that is injured. You don't want to overstimulate that area, because then the body gets guarded. So make sure you write down everything that they're telling you, and that you highlight all the muscles that you're going to work on. And soap notes. I can't emphasize enough how important soap notes are, that you take, you write them down, all the treatments that you did. Did you do range of motion, passive, active, what muscles you treated, what else did you do? Did you incorporate, cryotherapy or heat therapy? All of that's very important. And a treatment plan. Usually with a Swedish massage, if there's nothing wrong with them and they want to come in every 2 weeks, every 3 weeks, once a month, is okay. However, when a person is injured, you want to get them in, closer together. You don't want to wait 2 weeks or 3 weeks between treatments, because it's like starting over again. If they have adhesions and you're working on the fascia, you're doing myofascial release, if you schedule them 3 weeks from today, you're going to have to start all over again. So with injuries, it's a little bit different. I recommend 3 massages once a week for 3 weeks in a row to be able to see improvement. That's different than when you're just coming in for a relaxation massage. Very important that you stay within 10 days and no more than 10 days, because then you have to start all over again. The adhesions begin to form with the fascia. So if you go to a PT or a chiropractor, wherever you go for therapy, it's usually 2 or 3 times a week, right? Same thing with massage. So make sure you explain this to your client at the beginning, okay? Make sure you explain to them what the treatment plan is, come up with a treatment plan and what works for them and what works for you. And the last thing I want to talk about is building trust. That is half the battle, half the winning for getting somebody to heal their body. Because if they trust you, they will heal a lot faster. It's very important to build that rapport of trust. I talk about this in my book. Don't forget to buy my book too on Amazon and leave a review if you've already read it. I appreciate that. But I talk in my book about a case that I had of a woman that had a rotator cuff from an accident she had had many years previously. And it took her 2 years to trust me to work on that shoulder. Now her shoulder was healed because that accident had happened like 15 years previously. However, she was very guarded. Emotionally, she had not healed from that, and she was very guarded. So please respect what the body is telling you. Never force anything, never push anything, never say, well, no gain, no pain, no gain. That's a no-no. You need to learn a little bit more and learn about how relaxation begins with the nervous system. So for your client to trust you is very important for you to, have that trust between the client and yourself so they can open up, relax, maybe at the beginning they're not so open, but they'll start relaxing. They'll start letting you work maybe a little deeper. This is where I say, let your hands do the talking. If you feel that they're tense and they're guarded, it's going to take you a little bit more time. You might need to go easier, maybe do a little bit of effleurage, warming up the muscles before you really get in there. So this is very important for when you're doing specific work, neuromuscular or medical massage, and I hope you take these notes and apply them for your clients. Until the next time, create a great day.